So for this question, we have a 30-year-old man that comes with reoccurring headaches and pain in his joints. He also says his wife has told him that his voice has become deeper. Vital signs show a blood pressure of 160 over 100. Exam shows coarse facial features and body hair, and his tongue is also noted to be enlarged. There is also swelling in both of his hands and feet. What would this patient be most at risk of? A. Coma, B. Cardiac disease, C. Immunosuppression, or D. Liver disease? So I'll let you answer the question and then I'll explain in 5 seconds. Okay, so the answer is going to be B. Cardiac disease. So this patient has acromegaly, which is going to be where you have excess growth hormone by a pituitary adenoma. So because of this tumor, you're going to get headaches because it's going to compress the surrounding areas. And even though the actual brain doesn't have sensation, you can't feel sensation from the brain, it can move the meninges in a way that you could end up getting headaches. And growth hormone has a wide variety of effects. So it acts on the bone. So for example, for the forehead, you can have frontal bossing, which just means you're getting an enlarged forehead. You can also have increased hand and foot size, hence the hand and foot swelling that the patient was referring to. You can have widened space between the teeth because your jaw's getting bigger. You can have voice changes, increased shoe or glove size, once again noting the hand and foot size increase, and then the nose size can also increase. So getting a patient's driver's license can be a good reference, or if they have old photos, because then you can see that they've clearly changed over the course of time. Even though from a day-to-day aspect, they might not notice the difference. If you look at a photo from many years ago, you could notice a substantial difference. And so moving on to the main part of this question, which is the heart problems. So the heart problems that this patient can have are CAD, ventricular hypertrophy, you can have hypertension. So all these problems obviously are associated with high mortality, and you can even get arrhythmias. So having this growth hormone being secreted in their body to an abnormal extent and duration really has a lot of implications for these types of patients and need to be monitored very closely. So the liver is also impacted by growth hormone and it can increase in size, but dysfunction of the liver doesn't really occur. And then coma and immunosuppression are not really associated with acromegaly. So the main takeaway from this question is recognizing the wide variety of clinical presentations that acromegaly could have. And they might give you a description. For example, they changed shoe sizes recently, rather than outright telling you that there's swelling of the hands and feet. And so just recognize the clinical picture that acromegaly has, and then recognize the biggest problem is cardiac disease. So I hope that helped, and thanks for watching.